So we've been talking about rural healthcare challenges for a long time. That's basically why Avel was developed in the first place. But many leaders now are saying that the pressure on them feels different, and it feels like it's heightened over the last few years. So from your conversations with hospital leaders, government officials, etc., what are these biggest pressure points that these rural communities are really facing right now?
It's complicated.
Absolutely.
And it depends. Like I talked about earlier, if you've dealt with one state, you've dealt with one state.
Yep.
If you deal with one hospital, we deal with one hospital. But I think there's an underpinning of just some of those core things like financial sustainability is key.
Yep.
And that's why having a virtual partner to help those hospital leaders, do more for their patients through a virtual partnership like ours is really key. Workforce sustainability is huge in almost every part of the country. Especially when you're talking about rural and there's many parts of this country that struggle to recruit, retain, and keep providers to take care of the population. That's where we, being a virtual health system that supports these local healthcare entities or supports a government with one of our out-of-hospital services, that's key. The other real impacting element is our rural communities are aging. And so, you've got a population that is, probably born and raised and lived in these rural communities their whole life. And now as they get older, they require more access to healthcare services. And that's across the continuum of what Avel provides for a lot of these rural communities. That's attractive.
Yeah. Can you go in a little bit more to access, and what does that really mean? I feel like sometimes when people think of access to care, it's like, oh, I just don't have someone in my community, but sometimes it's the distance of that. So can you talk a little bit about what access to care really means?
Yeah, and that's really, if you want to get to the core of what Avel began as, and that was delivering specialty care out into the country that created an environment so citizens didn't have to drive into the metropolitan to get access to a cardiologist or a dermatologist or a rheumatologist, pick an ologist. And that's, all the way dating back to 1993, that's our core. And so, now, more than 3 decades later, it's been even more exacerbated.
Yeah, absolutely.
And I think about, we've got such a strong relationship with the Indian Health Service. Super grateful for the opportunity to support the mission of the IHS in the Upper Plains. And, you want to talk about rural, you want to talk about frontier.
Absolutely.
There's a lot of miles between access points. And so a lot of the tribal communities in the Upper Plains, they don't know a provider, especially in the specialists, other than Avel. We have physicians who have supported those communities for almost 7 or 8 years, bumping up to a decade, where they've had this patient provider relationship. It's all been virtual, but that's all they know.
Exactly.
And it has been absolutely warming to hear some of those testimonials from patients about the value that virtual physician or virtual nurse practitioner has on the life of those folks in rural and frontier parts of the country.
Absolutely. When you've kind of hit on like the different areas, So does rural healthcare, like the premise of this, look different in different regions and states, or is the challenges that we're seeing all the same across, or do they look different based upon their territory and region?
Yeah, it's a great question, and I suppose it boils down to the rurality. I don't even know if that's a word, but how for some people in some parts of the country, Sioux Falls is rural.
Absolutely. Mm-hmm.
And we're 260,000 people in the metro.
Yeah.
But then, it's different. But we're pretty fortunate to live where we live here in the Sioux Empire, but able to radiate those services. Being connected to communities throughout the country.
Yeah.
With virtual services.
Absolutely. So if we are looking at all these different challenges, I know we started off with looking at the different pressures of them, and they've been increased right now. If we don't do something right now to help alleviate these pressures, what does that look like?
You can't open your news browser on any given day and read stories, especially in the healthcare space, about the economic challenges that rural hospitals and healthcare providers experience on a day-to-day basis.
Yeah.
And, going forward to continue to grow and provide support to those, a virtual partner has to be part of the equation. And, that's probably why we've experienced so much growth lately, over these last few years is because of that reality that all healthcare is local. It's relational, but having a partner like Avel to provide that greater access to care and provide pretty decent support to those local communities is imperative.